Okay, this is the last question that me and Claire and Jacob are going to be answering on this collaboration. But I just want to say, if you have enjoyed this collaboration, let us know in the comments, because we might be able to do more. A little hint there. If you guys want us to answer any questions that you would like to be answered, drop it down in the comments on Claire's video or my video, and we can answer your questions as best as we can. Maybe in the future. So, how can paramedics and nurses, come together and provide effective care? I kind of changed that question a little bit, but it's kind of the same thing. For me, as paramedics, we are going to be with nurses all of the time, handing over to patients. So the thing I would probably say, communication is massive. In the ambulance service, you need to communicate with the nurse effectively. Because when we hand over the patients to the nurses, we need to get everything across. We need to get all the, like Claire mentioned, all the allergies, everything that we need to come across. Because what we say is going to benefit the patient. Obviously, when they accept the patient over as well, they will do a proper head-to-toe examination. But everything we give would help that patient in his care that he's going to receive at the hospital. So I would say communication is massive. Listening skills is also a very important thing as well. You're going to be handing over to the nurses, but listening to the questions they have as well is also very important if you're going to give the best care. Strictly because if they ask, has this patient got such and such or such and such, if you're not really listening to the nurses, there's no point in you even going to give handover. You giving that handover is very, very important for that patient. And if you're not listening to your peers or to the patient when they say, I'm allergic to penicillin, if you're not listening, it's not good. So listening skills is very important if you're going to be collaborating with nurses to provide an effective, not just pre-hospital care, but hospital care as well. Is very important. Even in emergency medicine, is very important. Paramedic and nurses are trained, very, very high in order to deal with, difficult situations. Sometimes paramedics would, take over a situation, and sometimes, if a paramedic is not sure, they would hand over to the nurses. For example, if a said patient had a bleed, we would get them to hospital as quickly as we can, and then hand them over to the nurses at the hospital. There's some jobs that the nurses couldn't do, pre-hospital, and that's why us paramedics are there. But there is also jobs that paramedics couldn't do pre-hospitally, and we have to hand them over to the nurses. So it's very important that we work effectively in order to meet in the middle. It wouldn't work if the nurses would, come into the pre-hospital care, sign a card. It's very important to meet in the middle with nurses and paramedics to provide the best care for the patient. And, obviously on his journey through the pathway of care, and providing effective care for that patient as well. The collaboration with me and Claire is kind of important because I wanted to, support nurses. I wanted to support paramedics. The care that they do, the care they provide for the public every day, 24 hours a day. We take it for granted, and there's people working out there like me and Claire who are studying our lives, our lives away to, provide care. We want to provide effective care for the public. If you didn't, then you wouldn't be going into the sort of job, if you get what I mean. It would affect you that much that you give up. You're going to have difficult shifts on placement. Obviously, Claire will tell you she's been on placement. You're going to see some stuff that you don't want to see. You're probably going to get abused on the front line as a paramedic and nurse. You're going to deal with stuff that you probably didn't even expect you to deal with. Difficult cases. As a paramedic, you're going to be dealing with mental health cases that you're not even really trained for. We're trained to give, these medicines to, when people go into cardiac arrest. Nurses are very trained highly in dealing with in situations like that as well. But when someone struggles with mental health, it's very difficult. It's very, very difficult. You're going to be seeing stuff that you don't want to see. So if you don't want to go into the profession, you're not going to go very far. But if you have what it takes, if you have the passion and determination to achieve your dreams and you want to provide effective care for the general public, it is the profession for you. And I hope this video has helped people. I hope it inspires people to join, either paramedic science or nursing, or maybe they will like to go into midwifery. They've watched this video and thought, actually, they are following their dreams. And just because grades, you might have a really tough time in school, you've had a cry, you've got yourself a cup of tea, a coffee, or a refreshment, and you thought, you know what, I'm going to do this. And if you just left school, and you're sitting there on your bed and you think, did I have to do bad in school? Look at different options. Go to your local college or local sixth form and say, how can I get into the sixth form? And make a plan of success. That's what I did. It sounds really silly, but where's your next step going? Don't stand still. It's very easy just to stand still and not progress anywhere. Make steps forward in the right direction, and eventually, I promise you, that it would all be worthwhile in the end. If you have enjoyed this video, and if you have any questions that you would like me and Claire or Jacob to answer, drop it down in the comments. And to all you nurses, paramedics out there, I respect you and thank you for providing effective and efficient care to us. Thank you from the bottom of my heart. Thank you. The NHS is amazing. Make sure you like this video, and from me, goodbye, and I'll see you in the next video.
My next question is how nurses and paramedics can work in collaboration together to benefit a patient. So wherever you are working as a nurse, you will probably come into contact with paramedics, because if you're out in the community, definitely, because they are the first point of call. And I know as a general practice nurse, if I've got a patient that's collapsed or they're having a suspected heart attack and they've come into me, I'm going to need to be on the end of that phone, probably to Kyle. Kyle, come on. Come and sort this patient out for me, because I haven't got a clue. I have got a clue. But they're going to need emergency care that I can't provide out in the community. And paramedics are going to be so useful to me, and you can't think you're never going to see a paramedic, whatever area of nursing you're going to be in, because you will see a paramedic. And when you're working on the wards as well, you might get paramedics bring a patient straight up to your ward or into A&E. If you're in A&E, you're going to be working hands-on with paramedics, so your communication with the paramedic is going to be on point. It has to be on point, because you need that tight communication between each other to know exactly what's going on with your patient and what they need from you to make them better. And not only that, but handovers. Massive thing at the minute that we're doing at university is all about handing over to somebody else, or taking that handover. So if you're the nurse on A&E receiving that patient, or on a ward, you're having that patient brought into you by the paramedic, you need to know everything about that patient before that paramedic leaves, because when that paramedic is gone from your setting, you are with that patient, and you're going to need to know everything. You're going to need to know the allergies, the blood pressure, all the observations about them, what tests the paramedics have already done that could be helpful to you. Anything that's going on with that patient, you need to know. Every slight detail could be important. Not only that, but when you're handing over a patient, so if I'm in general practice, I've called the paramedic, they come out, I'm going to have to hand that patient over. They're going to need to know everything, every detail that is wrong with that patient in that moment of time. I need to make sure that my communication to that paramedic is clear, so that they understand it's precise, and that they've got all the information they need, because they need to take that patient, they need to assess them, they need to manage it and figure out where that patient needs to go. So then they need to then hand over my information, their information, onto A&E and maybe a ward. So it's just a knock-on effect. So from the off-go, your communication has to be on point. And we've been learning lately what we call an SBAR tool. I'm going to put the link below for the SBAR tool. And the SBAR tool is basically, it's SBAR. And it is literally situation, background, assessment, recommendation. So you're passing over, that's your handover. You're telling them the situation, patient's background, your assessment and what you've done. So that could be observations and things like that. and recommendations. So you're going to tell them, okay, I've done this, I've given them IV fluids, I've given them paracetamol, I've given them antibiotics, I've done this, I've given them aspirin if suspected heart attack or stroke. So any advice from you that I can do next while I'm waiting for you to arrive? So that's one of the things that you have to do for recommendations. And also get the person to repeat back what you've said to them so that you know they've fully understood all of your information that you've handed over. It's important for nurses and paramedics to work in collaboration. You have to have that tight collaboration, I feel, with paramedics, and that goes across the board wherever you work. And it is literally down to communication, body language, open body language, be friendly, don't be threatening. I've only ever had to call out the paramedics once, and that was when I was working on my bank shifts out in clinic, and we had a patient collapse and they weren't coming round, and we were like, oh my God, but they were breathing and everything, but we were really worried about them. And so that's when we had the patient, and that's the only time I've had to deal with paramedics. Which is lucky for my patients, but I love it. I love knowing more about different areas across the board wherever you work, and it is literally down to communication, body language, open body language, be friendly, don't be threatening. I've only ever had to call out the paramedics once, and that was when I was working on my bank shifts out in clinic, and we had a patient collapse and they weren't coming round, and we were like, oh my God, but they were breathing and everything, but we were really worried about them. And so that's when we had the patient, and that's the only time I've had to deal with paramedics, which is lucky for my patients, but I love it. I love knowing more about different areas, different fields of nursing, different fields of the healthcare system, so the paramedics, what they do, anaesthetists, doctors, surgeons. I love to know because we're all a team together. We're all this massive jigsaw puzzle that are making this huge picture, which actually creates your patient, because that's your end result. So you've got your patient, you've got all these pieces that people are inputting to make up your patient and your patient care, and that's so important. I think if you are looking to go into nursing or paramedics, please do it. Whichever you choose, you're going to have an amazing career and love life. And that's it from me. So have a great weekend, guys.
This part of the video is basically how I think paramedics and nurses are able to work together to give the most effective emergency care for a patient. So paramedics, they'll be going out to those situations where they will be giving life-saving care. We give the primary emergency care. We don't give that secondary care. As soon as we take that patient to the hospital, we'll hand that patient over to the nurses, and then they take care of that patient from then on, really. Basically, they are absolutely brilliant at doing that. Nurses are absolutely brilliant at taking care of patients in the long run. Not Jonathan Wass. Anyway, they're absolutely great at taking care of patients in that long-term care. Paramedics, they are great at taking care of patients in that short-term emergency care, and that's how paramedics and nurses are able to work together. We are able to keep that patient alive and healthy for that time span from that incident to the hospital, and even if it's transferring patients. And because we will be seeing nurses quite a lot, we'll have that kind of mutual understanding of what's going on. Obviously, once I start Paramedic Science, I will get to know how they're able to work together more, and how they're able to use both their clinical skills together. Obviously, there are going to be things that are the same in both Paramedic Science and nursing, but before uni, I'm not the best at basically saying how they are able to physically work together, just because I haven't done that yet. And once I do that, I'll be a lot better at it. I know that the paramedics are able to give amazing emergency care, and once it gets handed over to the nurses, they are able to make those big choices of the rest of that patient's care. I mean, paramedics, nurses, doctors, even midwives are able to work together as a team to save a patient's life. Once we are in that hospital, we are able to hand over to that nurse or that doctor or that midwife basically what has happened to that patient and any past problems with that patient. So nurses are brilliant at that sort of stuff. Once I do get into uni and I'm able to learn how we are able to really communicate with nurses and really help save someone's life with a nurse and have that multidisciplinary kind of team to, you know, give that patient the best care pathway and best healthcare pathway that we possibly can, and maybe hopefully save that patient's life, which is absolutely brilliant to think about, how people are able to work together like that, even though they're in different positions, like emergency care, long-term care, and doctors. They are just absolutely insanely fantastic at that sort of stuff. But yeah, that's just been kind of a little quick overhaul. I haven't really got too much information on it, to be honest with you, because I'm not in uni, so I'm not the best at giving it, and the best person to give this, to kind of say this sort of stuff to, is probably Claire, because she's in uni and she will be learning how paramedics and nurses are working together. So obviously, if you are on my channel, give a little look at Claire's channel, and she's brilliant at that sort of stuff. But obviously, please come back to our channel as well. Because once uni starts, we do start uni, then it just all becomes real. Then all this information will be coming into my mind straight to your minds. So yeah, that's been me basically saying how I feel nurses and paramedics are able to work together to hopefully save a life. This has been Touring It, guys. I'm really happy doing this collaboration with Claire. It's been absolutely amazing, and since it's the first time I've been doing it, it's been completely surreal. Being out somewhere in the city, it's been insane seeing other YouTubers, and you know, it's just, I can't really describe how thankful I am that we're even in the position we are in now. But yeah, thank you guys so much. Like and subscribe, and see you soon.